demonstrations in support of CDC officials who are resigning to protest the firing of the agency's director. This afternoon, the White House confirmed that President Trump has removed Dr. Susan Menarez as the head of the Centers for Disease Control and Prevention. Dr. Menarez's lawyers previously denied the administration's claim that she'd agreed to resign following clashes with the Health and Human Services Secretary, Robert F. Kennedy Jr. This morning, some of her top lieutenants were escorted from the CDC's headquarters after the announcement of their resignations. They include the CDC's chief medical officer, the head of its vaccine and respiratory diseases program, the head of the National Center for Emerging Infectious Diseases, and the CDC's public health data chief. All of this leaving America's public health agency without critical top leadership, and despite the fact that Dr. Menarez was nominated by the president, by this president. She was sworn in less than a month ago.
Look, what I will say about this individual is that her lawyer's statement made it abundantly clear themselves that she was not aligned with the president's mission to make America healthy again. And the secretary asked her to resign. She said she would, and then she said she wouldn't, so the president fired her, which he has every right to do. It was President Trump who was overwhelmingly reelected on November 5th. This woman has never received a vote in her life, and the president has the authority to fire those who are not aligned with his mission. A new replacement will be announced by either the president or the secretary very soon.
All right, our panel is here. They'll weigh in shortly. We're going to get started, though, with CNN's Elena Treen. She is at the White House for us. Elena, what more is the administration saying about this firing and the wave of resignations that's left the CDC leaderless functionally?
Yeah, we're starting to hear, Casey, from top White House officials and even the Health and Human Secretary, her Services Secretary, RFK Jr. today about this. And you're right, this move has left, we've seen now 4 top officials, 4 leaders at the agency resign abruptly because of the ousting of the CDC director. And kind of the through line from all of the comments we've heard from people at the White House has been, look, anyone at the CDC, the director, but also anyone else, really employees, if they do not share the president's vision, particularly when it comes to the Make America Healthy Again agenda, their jobs could be in jeopardy. And that's what Caroline Leavitt reiterated on the podium during the briefing. Take a listen.
If people are not aligned with the president's vision and the secretary's vision to make our country healthy again, then we will gladly show them the door.
Now, Casey, we did, like I mentioned, hear from RFK Jr. as well, the Secretary of Health and Human Services. And he said essentially, he was on Fox and Friends this morning. He didn't go deep into some of the details of this, saying he didn't want to discuss personnel matters. But he did acknowledge that he said if there's a deeply, deeply embedded malaise at the agency, we need strong leadership that will go in there and that will be able to execute on the president's agenda. But look, what I would be watching for is next week, we know that Kennedy is going to be before the Senate Finance Committee for a hearing. This is going to be front and center, and I think specifically from what we've seen is some of these statements from those 4 top officials at the CDC. They described a culture of censorship, communication failures, and the weaponization of public health by the Department of Health and Human Services. All of that likely to be a key line of questioning from some of these senators who are already raising concerns about this firing.
All right, Elena Treen for us at the White House. Elena, thank you very much. All right, I want to go now to Dr. Tom Frieden. He had served as the CDC director himself from 2009 until 2017. Doctor, thank you very much for joining us here. I'd like first for you just to tell us what your reaction is, what you think the implications are of the president firing the CDC director he installed after Robert Kennedy Jr. asked her to resign.
This is unprecedented. In the 80 years that CDC has been protecting Americans from health threats, there has never been a CDC director fired. But what's even more concerning is what is coming out about the reason, which is that Dr. Menarez, who's a respected scientist appointed by the Trump administration, was being asked to do things that are not consistent with the facts. She was being asked to rubber stamp recommendations made without due process that would endanger the health of our children. This isn't about disagreement with the president's policies. These are individuals, the leadership of CDC. I know all of the individuals who resigned in the past 24 hours. All of them are dedicated scientists, doctors who have dedicated their whole careers to protecting Americans. This isn't about disagreeing with the goal of making America healthier. This is about standing up for Americans being able to understand how decisions about our health are being made and making sure that those decisions are made on the best available facts, not on some theory that Secretary Kennedy has been espousing. You know, what we've heard from the secretary since the day he joined is a series of false statements, things that are just not true about vaccines in particular.
So speaking of vaccines in particular, we of course had the new recommendations around the COVID vaccine that came out yesterday. How much do you think that had to do with it? And it does sound like you have some kind of nuanced understanding, perhaps have been in touch with some of these players. Which vaccine issues do you think specifically are driving this? I mean, what more can you tell us about that?
Really, just from all of the statements of Secretary Kennedy, we see the repeated statements of falsehoods. I will give just one example that hit me hard. When Secretary Kennedy announced that the U.S. would be withdrawing its support from Gavi, the vaccine alliance that has provided vaccines for hundreds of millions of children around the world and prevented millions of deaths. He recorded, this wasn't off the cuff remarks, he recorded a 3-minute video in which he stated multiple falsehoods, things that are deeply misguided, deeply misleading, and that are going to result quite possibly in kids around the world not getting the vaccinations they need and dying. In the US, if the advisory committee, the ACIP, doesn't recommend a vaccine, then a program called the Vaccines for Children program doesn't provide it. That provides half of all the childhood vaccines in this country. We're talking about the risk that our kids are going to be more vulnerable to disabling and potentially deadly diseases because of beliefs that the secretary appears to have that have no basis in fact.
Doctor, speaking of things that Robert F. Kennedy Jr. has said in public, I want to play something for you that he said in the cabinet meeting. He does not make a tie explicitly with vaccines in what he says here, but I think that, you know, context, and we can talk about that on the other side, is important. Let's watch it, and then I'd like to ask you for your reaction. Take a look.
We're finding certain interventions now that are clearly, almost certainly causing autism. And we're going to be able to address those in September.
So there has to be something artificially causing this, meaning a drug or something. And I know you're looking very strongly at different things, and I hope you can come out with that as soon as possible.
Do you have any idea what Robert F. Kennedy Jr. is talking about?
No. There's been decades of research on autism. We know first that there's better recognition of the problem and that this is driving some of the increase. And from superb studies done by a center at CDC, which this administration closed, we know also that there's also a true increase in autism. There are some things that are proven to increase the risk, for example, increasing paternal age. And there are other theories about it. One thing that we know for certain is that it is not related to the measles vaccine. That's been studied in hundreds of thousands or more than 1 million children, and no association, but something that was asserted, proven to be false, and continues to be stated. This is really very concerning. I have worked with families with autism. It can be a very challenging condition to deal with, and we do want to find out what can be done both to prevent autism and to better support the people with it and the families dealing with that.